Now we're going to use the foam roller as a fulcrum, and we're going to work on thoracic extension here. And go ahead, Alex, get positioned. This one, you keep your hips down. You don't lift your hips up, and you just start in a couple different areas, and you do a few of those, just like that. Just rocking back and lifting. And notice he's keeping his ribs down and just reaching back and really trying to get that extension into here. This is something we lose with age, and especially if we're chunners, because hey, what are we doing, right? We're like this all the time, and then we go to our job, which is like this all the time, so the next thing you know, this is how we are at 50. So we have to be able to move and articulate this thoracic spine. So this is a really, really nice tool. And then just try to let your hands just hang and really reach it. It's just nice, keeping the breath, keeping the work. Good, good, good. Something to do, a few minutes. We don't do this for a long time. Something to do for a few minutes on a daily basis. All right, now we're going to be talking about the lat. The lat is a huge muscle on the side. It functions primarily as a stabilizer in movement. So a lot of times though, it gets really, really, really tight and restricts mobility in the shoulder and in the spine, because it runs from the border of the scapula all the way down to the pelvis. It's a huge muscle. So we're going to start off with a little, again, myofascial release with the roller. We're going to hit right under the armpit. We're not going into the armpit. That's a no-no. Blood vessels and nerves, you'll booger yourself up. So we're staying on the edge of the scapula with the foam roller, and then we're going to do some stretching. So Alex is going to demonstrate that. So go ahead and get on your side. Yeah, nice roll. And you see he's oblique to it. He's not lying right on it. He's not crushing those soft tissues that I told you can't roll on. So he's just working that a little bit. Not going too high up on the arm, because we don't want to dislocate that shoulder. It's all in on the scapula. So just working that scapula, a few rolls. Again, if there's like a knot that's tender, then you just kind of embrace that, take a couple breaths. All right? So we want to do both sides, so go ahead and show him from the other view. So he's flipping around. And you can just see where he's rolling and how far he's going, and it's just a few strokes. This doesn't take long. And again, when I'm doing these type of things, I don't spend much time. I spend about a minute, a little bit longer than that, but that's it. And then we go into stretching. I tell my patients all the time, this is for tenderizing the muscle. You can't stretch a brick. You need to soften it up so you can get the stretch out of it. Okay. So now he's going to demonstrate using the foam roller, and actually, let's use the ball. I like it. It's a little more clear. The position for this is pretty easy. Exercise balls are everywhere. So Alex is going to get on this facing me, and the whole thing with the thumb up. Yeah, just one at a time. All right, I want you to stabilize on the ground with this hand. So one hand is on. The contact point is the wrist. Notice the good Wu Sao stroke, man. Even though he's not doing Wing Chun, it's trained. It's part of his brain. So he pushes it out. It just gets that nice stretch. He's not putting weight on this. He's just stretching it and bringing it back. A few nice stretches. Really focus on the contact point being the wrist. Getting a nice stretch all in through here. Excellent stuff. So these are some more ways of just increasing mobilities to muscles that get really tight, the pec minor and the lat.
You're on.
Okay, now we're going to do an exercise called bookends. And there's lots of pieces to this. And this bookend is for this thoracic mobility issue that we get where things get locked up. We talked about this. Now we're talking about the rotation that we lose. And again, if your thoracic spine can't rotate, something's got to make up for that, and that's usually your shoulder and your neck. And a lot of neck problems come from this loss of thoracic mobility. So Alex is going to get in position here. We're using the foam roller as a support. Some patients also need a pillow for their neck. Depends on their mobility. And again, this is something you're going to have to decide. Now, why am I bringing this up? Why is this a 90-degree this lock? I want to get this mobilized, not his lumbar spine. The lumbar spine is not designed for rotation. The thoracic spine is designed for rotation. So if this starts to rotate, it's going to hurt. So by getting it into 90 degrees of flexion here, or a little more, I'm going to prevent that. I'm going to stabilize the lumbar spine. He's hooking the hamstring, and then just go ahead and start with a rib pull, and then just go back. And he's just opening the surface up. So we're starting here. There's a lot of different hand positions. This is one. Behind the neck is another one, and letting the arm go. Now, some patients or clients, they can't do that one. It's too much stress on the shoulder. Their hands will start going numb. They've got other issues. So I don't care how you do it. You know, I would play with them all. Now, I'm going to get him to do the one behind the neck because I want to bring out some points. So the goal is for his shoulder blade on this side to be flat, and this to still be in vertical. This to be flat, and this to be flat on there. So what am I going to do to get that flat on the mat? Sheaf does this with his stretching routine. Everybody's familiar with this. You know, that's one thing I dig about Randy. The things he's taught me, you know, a lot of them with the breathing and holding the breath and how to use breathing to get stretching. Well, you know, it's a new discovery in physical therapy and chiropractic world. Randy already taught us all that. So here we go, really deep breath in and blow it out. And just kind of relax. And now he's going to take a real deep breath in. I put my thumb here on his diaphragm, just make sure it's doing its job. He's going to hold it, just hold it. 1, 2, 3, 4, 5, 6, 7, 8, and go. Let it go. And you see how much you got? Just like when we do that crazy toe touch with our hands, and Randy has us doing that. It's the same thing. So another deep breath. Hold it, hold it. Take a little deeper breath. Yep. 1, 2, 3, 4, 5, 6, 7, 8. Let it go. Let it go. Nice. And just opening that up. This might take minutes. And I wouldn't expect, if you have poor rotation, to be able to get that shoulder blade on the floor in one time or in 1 week or 1 month. It might take months. But you have to continue to work at it, just like everything else, because the stresses that we put in it in life, working at the computers or jobs or training, they undo it. So that's why we have to do these things every day. Okay, so we did thoracic mobility with a slow, passive breathing stretch. Now we're going to do it in an active form. Notice we have a nice long spine here. Nothing's rounded. Again, I want the action, the rotation to take place right here. Nothing here. So I'm going to keep this locked out and safe, and this is the position you do, kind of like a child's pose in a sense. All right, he's going to take this hand and put it on the back of his neck. Okay, he's going to take a deep breath in. Yeah, bring that down. Take a deep breath in and blow it out. And he comes up to here and keeps working it. Inhale and then exhale. And on the exhale, another thing I'd like to get, bring it up, point this elbow at the sky and pinch that shoulder a little bit. Pinch the shoulder blades together at the end. Just a 2-second hold. Come back up. Point the shoulder blade at the sky, pinch, and down. It's a lot of work. So this is an active recruitment for this. One more time. Bring it up, pinch, point, and relax. All right, go ahead and sit up. All right, thank you.